Okay, so we're going to talk about decoupling exercises and how they fit into chiropractic rehabilitation. We see decoupling exercises, and these are some examples from the upper extremity. Here we see the shoulder, and for the cerebellum, we're going to activate circular or complex movements around the shoulder joint. For the elbow, we have complex or circular movements that are centered around the elbow. And lastly, for the upper extremity, we have the digits moving, or the finger doing either a circle or complex movement. So we relate these exercises to the deep cerebellar nuclei here. The vestigial is midline, so that doesn't really fit into what these exercises we're showing here. You have your interposed group, which is the globose and the emboliform. And globose relates to the shoulder, where the emboliform relates to the elbow. And finally, the dentate, which relates to the digit or the finger. So to remember these, you have your digit, dentate, elbow, emboliform, and glenoid, which refers to the shoulder, and globose nucleus. Now these deep cerebellar nuclei are attached to the motor homunculus on the opposite side. So you see here a big facial representation of the vestigial nucleus. Then look at the size of the dentate nucleus, because it's referred to or related to the digits and their motor function. Now when we look at the interposed nuclei, the globose that does the shoulder is relatively small, and the emboliform, which does the elbow, is relatively small. Now I want you to pay attention to this relationship, because the vestigial nucleus, as it controls the head and the neck, is relatively small compared to the facial muscles of facial expression. And look at the juxtaposition of these. So when you have a cervical dystonia, you're going to get blurring of these maps, and you're going to have to decompose or decouple movements in the neck and shoulder, or neck with the shoulder or from the shoulder. And that's why we use these decoupling exercises, because they activate very specific parts of the motor cortex through very specific parts of the deep cerebellar nuclei.